And so now joining me is Congressman Ryan Zinke. And Congressman, I know you're a very busy man, and today is a big day with you getting called in today, but also at 4 o'clock we'll learn a lot of things. What's it been like, I guess, as we get ready for this afternoon?
Well, I've spent a lot of time in the county commissioners across Montana, food banks, talking to people that are affected by the shutdown. And look up front, I'm a former SEAL. A shutdown is a really bad idea, and it's always executed poorly. Because what it does is it hurts people that just don't deserve to get hurt. People work, federal employees are out there, they're working, they're doing their job, they're not getting paid. And there's one thing from a SEAL commander's point of view that I've always learned is you don't mess with the sailor's pay, because when you do, you mess with the sailor's family's pay. And the same thing with our federal employees that are out there every day doing their job. Look, it affects them and affects their families. So I'm glad that the Senate has come with a conclusion. The House is going to respond, and we'll be able to go forward in this and learn a lesson. Look, this shutdown, what was it over? It wasn't over healthcare. That's why we have committees. That's why we have appropriations. And everyone realizes that healthcare is a problem. But to shut down the government and cause harm, in my opinion, it was unjustified.
You mentioned several different things. So let's start with uh, what's happening today with the process. What can be fixed today and you know moving forward, just because if the president does get to sign, how long could we see things sort of get back to normal with it, whether it's the airline traffic controllers or forestry workers that would be a huge thing for here in Montana. How quickly could things get back to normal?
Well, there's some good things in the bill. One is it back to appropriations. And I'm a big fan of the Constitution. I think we all should be. Article 1, Section 9, no money should be removed from the Treasury unless by consequence of appropriations. So there are three important bills on appropriations going back to regular order. And look, the government isn't just a light switch. Let's say that the president signs this tomorrow, be under some ceremony, circumstance, even as far as tonight, a possibility. But the government isn't going to change visibly as far as air traffic control, because what's being driven is by statistics. The air traffic controllers, those that are at their desk, they make sure that we're going to fly safely, and it will take a while to go back to normal. So if you're thinking that if we get out of the shutdown, the airlines will be great on Friday. I would take the weekend to rake some leaves around Montana and stay home.
So for those that have been impacted, and you mentioned don't mess with a sailor's pay, for people that have been without and they might have had to use credit cards just to survive, uh, what message do you have for them? Because I think they're scared. They're wondering, how long will it be before I see back pay? How long before we start getting paid? With all those kind of questions, what is the answer? What do you foresee?
Well, again, the process will be put in place for people to get paid. They will get back pay. You have WIC, you have SNAP, a lot of services that really are required and needed. And look, there's people that need a little help up, and this is why the government should be there, to help them. That's part of our duty. But I see some optimism. I do see appropriations going back to regular order. I'll also see that, look, this has been a mistake. Shutting down the government again is a really bad idea, and it's always poorly executed because ultimately it hurts people that just want to get on with their lives. They want the government to function. They want to get paid for their work. And the backlog, when people aren't working, the backlog becomes greater and greater and greater. And it'll take some time to go through the backlog of work that has been basically set aside. But I'm glad it looks like we have a solution. I hope the president will sign it. It's nice to be back working as what my job description is, a member of Congress and representing the great people of Montana.
If he does sign it, I think a lot of people are concerned this is through January 30th. How do we prevent going through this all over again?
Well, the issue is funding and appropriations. I think everyone realizes we're $36 trillion in debt. And to me, if you're gonna, it's kind of like going a bus up a hill. We're $37 trillion in the hole. If you want to put additional weight on the bus, you got to take something off. And look, on healthcare, if the issue is about healthcare, that's why we have committees. But let's look at fraud, waste, and abuse in a better system. Obamacare has been a failure, but there's some good parts. There's pre-existing conditions. There are some good parts of that program. I think we should look at ways to improve it. Ultimately, if the argument is about healthcare, then it should be about improved access, affordability, and quality of care. Those are the three tenets of healthcare. It's not shutting down the government.
Well, since you brought up the healthcare, according to October story by CNBC, research by KFF Health, they found that health insurance premiums for plans that were bought over, I guess, the Affordable Care Act marketplace, well, that could increase 114% on the average. So people are scared here in Montana. Is that something where it could be almost not even affordable when it comes to healthcare? What is the big concern?
Well, people are paying, on average, well over $20,000 a year for healthcare. Yeah, in many cases, that's about what they pay for rent. So Obamacare has raised healthcare by 60%. We have people in the roles that should not be there that are non-citizens, illegal aliens. We have a lot of fraud, waste, and abuse in the system. So look, it's about the triad of access to care, affordability, and making sure the quality of care is there. There's ways to do this, but I think we should look at all options and focus on the problem. But the problem is not keeping the government open. To do it, what this shutdown was not over healthcare; it was over protests. And as a Navy SEAL, what do we fight for? We fight for country, we fight for friends, we fight for freedom. So what was this fight about? It wasn't really about healthcare. In my opinion, it was about protesting. Opposition just does not like President Trump. In many cases, they hate him. You see the anger out there. And so they want to protest and they want to show their base that we're going to protest. But if you're going to fight for something. How about fighting for freedom? But you can't, fight for things that are wildly unpopular in the United States, like, for instance, men, playing women's sports, transgender mutilation of children. We can go on a socialist agenda. That's not what this issue is about. Let's just open the government. And look, if you want to talk about healthcare, you want to talk about debt, you want to talk about issues manufacturing our country, that's what the legislative process, that's what committees, that's what bills actually do. So study your history, study the Constitution, and let's go forward as a country. But let's do it by getting the anger out and just focus on solutions.
Since you mentioned you see it as a protest and trying to get the anger out, then how can Congress kind of work across the parties? How can we kind of get to an agreement where we don't get back into this situation? Because the feedback we're getting from our viewers is they're scared come January 30th, we're going to go through this all over again.
Well, I'm encouraged that we have three of the appropriations, on this bill. There's a plan to go through all 12 of them, kind of like 12 days of Christmas. To make sure we do our job. Congress has to do our job. Our job under Article 1 is to fund the government and declare war. Those are our two primary jobs. Yes, we do pass laws, but the president signs them in place. So let's just do our job. Let's get the anger out of the equation. And let's make sure the job makes Montana and U.S. a better place. We're the greatest country in the world. Let's show it.
Coming back to Montana, this is the longest shutdown in U.S. history. So you have federal employees, which especially you see here in Missoula, a lot of them, especially of forestry workers, and they've been kind of hit hard. So is forestry, is these are considered stable jobs, good jobs in Montana. With what's happened, do we have to look at it as a Montanan? Are these no longer good jobs? Are they still good jobs?
Well, there's still good jobs, and there's needs to be reform and making sure we do it better. But yeah, if you're a federal employee, look, you should be paid for what you do. Look again, from a Navy SEALs perspective, is that when you got families out there that are hurting, and the economy is not great, gas prices are going down. There's some optimistic signs. But it's still a struggle, and not having a paycheck. You mentioned credit cards. Well, credit card rates are 20, in some cases 25%, right? So someone is paying when you miss a mortgage payment, you have to balloon up what's on your credit cards and carry a bigger balance. That costs you money. But again, let's focus on getting moving forward. Shutting down the government is never a good idea. Again, it hurts people that shouldn't be hurt.
You said earlier on that you stopped by the food banks and were talking with the different groups like that. What were some of the questions that they brought to your attention, some of their concerns? Because I had a chance to recently tour the brand new facility at the Montana Food Bank Network, and they're trying to get in as much as they can to help people because we're seeing too from feedback that we're getting, people are concerned that we're using like benefits like SNAP. When you visit the people that were on that, visiting the food banks, what are the questions? What are the concerns? What did you see?
Well, you see, it puts some additional strain on food banks. You see that. Our food bank network does a great job, I think, but it's coming. Thanksgiving's coming up. The holidays are coming up. So I was out there, gave what I could, some checks to help some food banks, get through the season. But you see the people that they're serving, very grateful. A lot of time families, they just need a little help in there. People are struggling. Same thing with Halloween. I've been on a lot of events, handing out kids, candy to kids, and looking at the families and talking to parents. There's some concern, but that's my job, is to make sure that the government runs efficiently and goes back to work. So I'm confident that this will end. It's unfortunate that it ever occurred, but it did. But let's end the nightmare and look at focusing on solutions. If we want to talk about healthcare, let's talk about healthcare. Let's talk about the positive and negative effects of Obamacare. What's happening with prescription prices, with these healthcare networks that are a lot of times promoting abuse of the system. So let's talk getting rid of the fraud, waste, and abuse as a first line, and then let's focus on a better healthcare in Montana. The rural healthcare is a big deal. What was at risk was $50 billion that was in the one big beautiful bill for rural healthcare. The opposition wanted to take that out. That was part of their solution, taking out the very funding that helps states like Montana that have rural healthcare, which is a lot different than New York or San Francisco or LA. Our network is spread out, and we're a little different in Montana, and I think we should be recognized for that.
And I was going to ask you about that because I thought that was one area that we didn't talk about, which is the rural area. So for those rural areas, whether it's the healthcare, the government employees in those rural areas, how do we make sure that they can get back on track and they're not set back like we've mentioned already with the credit card debts, if that's what they're relying on? How do we make sure that the people that are in rural areas are not hurt even more?
Well, I'll give you an example. Life Flight. In Montana, Life Flight has saved, your friends, my friends, a lot of people across Montana. And Life Flight program was on the chopping block because, if you're in New York and LA, you don't really see it. But we defended it. We got the funds, back. But things like that, if you live in Montana, you understand how important it is because you're out in the middle of nowhere. If a deer runs across, you get hit. Cell phone coverage isn't great in Montana, and things like the life flight, save lives. We don't have the luxury of having every hospital in Montana be an expert on all things. So we're a little divided in Montana. Where are you going to send, a patient based on circumstance? And those type of things, rural healthcare, remote healthcare, telehealthcare, all those things are advancing, but they help Montana and they help the rural population. So we need to protect those and put money in to look at innovation to make it better.
Last question. Is there any roadblocks that could happen today? I know you seem very optimistic, but what is a concern going in today? I know that you were called back, and now you're at your office there, and by 4 o'clock Eastern time, we'll know a little more. But is there anything that could set something back? Could we have any concerns today?
Well, a fear for media purposes, someone might object to want to get in the light of the media and have their moment in the sun, so to speak. I would like to see more people cross the aisle because this hurts Republicans, Democrats, Independents. It just hurts all Americans. So, like the Senate, I would like to see more bipartisan. Oh, look, I am willing to talk about anything. I'm willing to. This is why we're in the legislative process. If you want to bring up healthcare, you want to bring up debt, you want to bring up manufacturing, you want to bring up energy, I am willing, to sit down with anybody and talk about if the solution is there. And that's part of what I call a loyal opposition. Is that the job of a loyal opposition is to be critical when you're wrong, compliment you when you're right, but always offer better solutions. And I think as a country, the goal is to have, to look at our country, make things better, to make a more perfect union. That is why Congress and the executive and the judicial, to serve the people. And when we don't serve the people in a government shutdown, I think you need to take a step back, push politics aside, and drive up the middle, working together to form a more perfect union.
Well, I appreciate your time. And is there a final message that you would like to tell the viewers here in Western Montana, or is there anything that I didn't ask because we covered a lot of ground?
Well, the good thing about being in Montana is we're in Montana, or we're not in Washington, D.C. And some of the problems are over the horizon. They affect Montana, there's no doubt. But the good thing is we live in a great state. We're a good people, and we're blessed.
Congressman, thank you for your time.
Thank you.